We've been doing this big research project about online misinformation about prostate cancer. And one of the most common topics that comes up is these supplements or the miracle pill, miracle cure. And you see these things and they get lots of views on YouTube and TikTok. Everyone wants the easy pill. I mean, if we didn't have to, eat healthy all the time and exercise, wouldn't it be great if we could just take a pill and it all goes away?
But unfortunately, there's no shortcuts to living a healthy life.
For sure, yes. And if you see something that's being advertised like, no side effects, miracle cure for prostate cancer, if it sounds too good to be true, it's because it is too good to be true.
Welcome back to the Rena Malik MD podcast. I'm your host, Dr. Rena Malik, urologist and pelvic surgeon. Today, our guest is Dr. Stacy Loeb. She is professor of urology at New York University and the Manhattan Veterans Hospital. She's board certified in urology and lifestyle medicine and hosts the popular SiriusXM Men's Health radio show. Today, we talk about everything prostate cancer. We talk about how to keep your prostate healthy and prevent prostate cancer. We talk about, does ejaculation actually play a role in preventing prostate cancer? And what to do to get screened for prostate cancer. When should you get screened earlier and how often? We talk about the use of MRI for prostate cancer and how to determine what treatment is best for you for prostate cancer. We also discuss lifestyle modifications for people who are newly diagnosed with prostate cancer, as well as starting testosterone therapy after you've been diagnosed and treated for prostate cancer. We hope you enjoy today's show. Dr. Loeb, Stacy, it is so wonderful to see you and have you here on my podcast. It has been such an honor to get to know you over the past several years, and I'm so excited to talk about prostate cancer and health today.
Awesome. Thank you so much for having me.
So, your interest in prostate cancer started because someone close to you had prostate cancer. Can you share sort of your story?
For sure, yeah. So actually, when I was in med school, my grandfather died of prostate cancer, and he really raised me, so it just hit me really hard. And I really actually didn't know anything at all about prostate cancer. I didn't even know that urologists were the doctors who treat prostate cancer or anything like that, but I sort of did a deep dive. And I saw some lectures about prostate cancer after that, and they were like, hey, is anyone interested in doing research on prostate cancer? And I was super interested, in anything that could help other families, not lose their grandfather. And so that was kind of where it all began, and I've basically been studying it every day ever since.
Yes. And for those of you who don't know, Dr. Loeb is very prolific in the area of prostate cancer and prostate health, and she's even boarded in lifestyle medicine. So today's conversation is going to be a real treat. So I think people want to know generally, what can they do to improve prostate health overall and prevent prostate cancer? So in terms of diet or other modifiable risk factors.
Yeah, so that's a really good question. And prostate cancer, it's like about 50-50 in terms of genetic versus like lifestyle and other things that happen during your lifetime. So there is a very large genetic component, and obviously we can't change our genes, but what we can do is know about our family history. And so if somebody does have a family history of prostate cancer or other cancers that may be related, like breast cancer, then, getting screened early is one of the best ways, at least to prevent an aggressive cancer by at least just finding it early. But in terms of things we can change, diet and lifestyle are extremely important in terms of the risk of prostate cancer and really any cancer. Not a lot of people seem to know this, but red meat and processed meat are considered carcinogens by the World Health Organization. So things like, bacon, salami, cold cuts, these are group 1 carcinogens, which means they cause cancer in humans. So that's actually like the same risk level as smoking and asbestos. And then other kinds of meat like beef, pork, lamb, these are considered group 2A carcinogens, which means probably causes cancer in humans. And that's the same category as like DDT, mustard gas. So, these are really like some of the foods that we should definitely avoid in terms of reducing the risk of cancer and prostate cancer specifically. And physical activity is very important, maintaining a healthy weight. All of these things are going to reduce the risk of cancer.
Yeah, and I think in terms of meat, I get a lot of pushback from people who are like, well, the studies didn't look at people who were having a healthy diet with grass-fed meats or not eating consuming other bad foods or like bad foods that are, not good for you, like simple carbohydrates and sugars. And so that's the pushback I get. So what do you say to people like that?
I mean, we've done a lot of studies on this in our group. And for example, we've found that the more plant-based food you eat and the less animal-based food you eat, the lower your risk of prostate cancer. So for example, we published about a year ago in a really large study, more than 40,000 people in this study out of Harvard University, that the men who consumed the most plant-based food had about a 19% lower risk of fatal prostate cancer, or like the cancer that kills you. So I think this is very real. And actually, it appeared that eating less of the animal food as well as more of the plant food are both important. So it's getting rid of some of those cancer-causing substances in the meat. But then also, the plant-based food has a lot of important things that help you fight cancer, like antioxidants, fiber, and these are only found in plant foods. So I think it is actually pretty clear.
Are there certain foods, so I know plant-based foods you've sort of shown and in multiple studies that have been beneficial, but are there certain foods, like I know lycopene has been extensively studied in prostate cancer. Are there certain foods or supplements for that matter that are beneficial in prevention?
Yeah, that's a great question. And so the specific foods that you would want to definitely incorporate into this plant-forward dietary pattern would be cooked tomato products. So that's the lycopene that you mentioned. And so cooked tomatoes, because it's actually better bioavailability when it's cooked. So that's good news. If you eat things like tomato sauce with, pastas or pizza or whatever it may be, tomato soups, these are all like easy sources of lycopene. Another specific food that's important to have in the mix are cruciferous vegetables. And this is like a big family of lots of, green leafy kinds of vegetables, things like collard greens, broccoli. And so this is another really great category. Soy products are also very good for the prostate, whether that's tofu or tempeh or whatever preparation that you enjoy. And then, nuts are also healthy for the prostate. And so soy and nuts are some good sources of protein that would be much more prostate healthy than meat or dairy.
Okay. And then in terms of things like zinc, vitamin E, I know there's been some data on that. Where do we stand currently on those sorts of things?
Yeah, so there's definitely been a lot of controversy over supplements. In lifestyle medicine, we really focus mostly on getting all of these substances from food. And if you are really eating like a whole foods plant-based diet, which is, mostly unprocessed plant-based foods with a variety of fruits, vegetables, legumes, you're really getting all of the vitamins that you need from the diet. And so really the only supplements that I think are very important in that case are vitamin B12 and vitamin D. Other than that, I really don't recommend any specific supplements for, reducing the risk of prostate cancer. Sadly, there had been some early evidence suggesting that some supplements might actually help prevent prostate cancer, like maybe taking selenium or vitamin E. And then they did these big trials and it actually, didn't pan out at all. So, I think where we're at right now is the best thing that you can do is to, eat a healthy plant-based diet and get all these nice, vitamins and antioxidants in the food.
Yeah. And I think that's important. I think a lot of people want a quick sort of, let me take this pill and it'll help me prevent prostate cancer. But unfortunately, there's no shortcuts to living a healthy life.
That is so true. And, we've been doing this big research project about online misinformation about prostate cancer. And one of the most common topics that comes up is these supplements or the miracle pill, miracle cure. and you see these things and they get lots of views on YouTube and TikTok and yeah, like, of course, everyone wants the easy pill. I mean, if we didn't have to, eat healthy all the time and exercise, I mean, wouldn't it be great if we could just take a pill and it all goes away? But, I am really sad to say that we just don't have the magic pill. And if you see something that's being advertised like, no side effects, miracle cure for prostate cancer, if it sounds too good to be true, it's because it is too good to be true.
Yeah, absolutely. And that's a great thing to go by, right? These supplements are not regulated. I talk about this a lot on my channel. They're not regulated. There's no governing body reviewing them, making sure that what's on the label is actually in the supplement. Usually the studies that are done on these supplements are really small studies. They're not often randomized controlled trials, although we have some, as you mentioned, for selenium and vitamin E and prostate cancer. They've done rigorous studies. And saw palmetto is one of those too for enlarged prostate. And so they've done rigorous studies for these supplements and shown ultimately that there's no benefit. And so while, probably taking supplements is not going to harm you, but they are going to cause you financial harm and potentially delay you from getting accurate care.
Yeah, I think that's a very good summary. And, I think that's a really good point that you make, that they're not regulated. And actually, there was a really scary case report that was published in Prostate Cancer where some people were taking these men's health supplements and they had some ingredients that were not disclosed that were actually testosterone containing, and they actually developed rapidly spreading aggressive prostate cancer after taking these supplements. And a few of them got pulled from the market subsequently. So at least, that particular preparation isn't out there now, but who knows what has replaced it. And I think, let the buyer beware.
Yeah, so they can be harmful. And there's actually been a study about how many people enter the emergency room related to supplement-related issues, and it's not insignificant. I don't know the number off the top of my head, but they can be dangerous at times, particularly because they're not regulated. Now, to move on to, you did mention breast cancer. I think a lot of people don't know that having a family history of breast cancer may put you at a higher risk for prostate cancer. So can you talk about that a little bit?
Yeah, for sure. So, prostate cancer genetics is really a huge area of research right now. And what we're learning is that some of the same genes that cause breast cancer actually also cause prostate cancer. So some of the listeners may have heard of things like BRCA or the BRCA genes. These are some of the, high-risk genes for breast and ovarian cancer. Turns out they also increase the risk of aggressive prostate cancer. So, for many years, even urologists would just ask patients, do you have a family history of prostate cancer? Yes or no, but that's not really enough. And actually, we need to know if they have any female relatives with history of breast or ovarian cancer. And there's other cancers that may be related to, like pancreatic cancer is also linked with these same genes, for example. So yeah, very detailed. It's really important for people to just, as much as possible, not all of us can get the details of our family history. And some people, may not know all of their relatives or have access to this information. But if you do, it's good to really find out the details of any cancers in family members, because that could affect your risk and also your children and your other relatives.
Yeah, it's really important. And prostate cancer is very common. It is the second most common cancer in men. Is that correct?
Yeah, exactly. And actually, they just published the 2024 cancer statistics, and the number of new cases is projected to be higher in 2024 than 2023. So it seems like the incidence of prostate cancer is actually going up, which was sad to hear. And it's also the second most common cancer in men globally. So definitely, this is very common. But, just like you were saying, men may not be aware that they're at a higher risk of prostate cancer because their mom or their sister had breast cancer. But this is also relevant for their children, whether their children are male or female. Having somebody in the family with prostate cancer could affect cancer risk.
Yeah. And so globally, it's the second most common. So there's really no variation across the globe. It's prevalent everywhere across the globe?
Well, there's definitely some variation. I mean, certain regions do have more cases than others. So, for example, North America, where we are, Northern Europe, these are some very high prevalence areas. Same with Australia, whereas actually there is a lower risk of prostate cancer in Asia. And some of this may relate to some of these dietary factors. So one day, just kind of for fun, I superimpose like the prostate cancer heat maps that show the incidence with like per capita meat and dairy consumption. And the overlap was actually like pretty striking. And so, and what they found, they've done some of these migration studies where, for instance, they look at people who, migrated from Japan to the U.S. And the longer they were in the U.S., their risk of prostate cancer actually started approaching people who were born in the U.S. Didn't quite reach it, but went up. So something about moving to this country, which is probably adopting the standard American diet or the SAD diet, because it's very sad what it does to the body. And so just moving to the U.S. and having our lifestyle here, seems to actually raise the risk. So there's definitely some variation globally, but yes, it is certainly, common worldwide, and it's great that you're raising more awareness about it on here, because it definitely doesn't get the level of funding or attention. And I think there is just some, stigma about screening and things like that.
Yeah, and we're going to talk about screening, but do you think that, you said it's rising, right? The incidence of prostate cancer is rising. Do you think it's all dietary? Are there other factors, environmental or otherwise, that may be contributing?
Yeah, I mean, it's probably a whole bunch of things that are contributing. I think for one thing, there has been some controversies about screening for prostate cancer over the last 10 years. So, there was a period of time where people were saying, maybe we shouldn't screen for prostate cancer. Not everybody believed that, but anyhow, so the screening kind of went down for a while, and so some people weren't being diagnosed with prostate cancer, and now I think screening has picked back up some. So some of it may sort of be an artifact related to how much screening is going on for prostate cancer. But yeah, it's probably a whole host of different things that are at play here.
When was the last time that your doctor spent an hour with you, listening to you and trying to really understand what your goals are? And when did you actually leave the doctor's office knowing exactly what your treatment plan was and what your next steps are? At my practice, Rena Malik, MD, I aim to do just that. I specialize in sexual dysfunction, bladder problems, hormone management, and pelvic pain. And I want to revolutionize how we take care of patients and get to know each and every one of you. That's why when you come to my practice, I'm 100% present with you for an entire hour. There's no one else involved in your care. It is entirely you and me. And if for some reason you want to ask me a question between visits or you forgot to ask me a question, you can message me at any time with a guaranteed response, with no extra hidden fees or costs associated with messages or any other communication that we have. And you don't even have to call the office to make an appointment. You can do it all easily online at www.renamalikmd.com/appointments. I see patients in Newport Beach and Los Angeles, California. I also see patients for telemedicine visits who are located in the states of California, New York, New Jersey, Maryland, Texas, Florida, Illinois, and Virginia. And if you're not located in those states, I can still see you for an educational visit where we can talk about your condition as well as what treatment options exist so that you can take that information to your doctor and discuss what you think is the best option for you. I can't wait to see you. Yeah. And, a lot of people, there was this one study that showed that ejaculation frequency was associated with a decreased prostate cancer risk. And this went sort of viral in the media. So a lot of my audience wants to know is ejaculation frequency or sexual activity or prostate play or things like that, do they affect your risk of getting prostate cancer?
Yeah, so great question. And that was a very interesting study, very popular topic. I've had that on my radio show a whole bunch of times with Jennifer Ryder, who was the first author. that was actually using the same database out of Harvard as some of those plant-based diet studies that I mentioned earlier. So really large studies from Harvard where they asked these men, to discuss, the recall, basically the frequency of ejaculation. And what they found is that the people who had ejaculated on average more than 21 times per month did have a decreased risk of prostate cancer, and it was statistically significant, and it was about a 20% decreased risk. So it's a pretty, substantial finding. So there is, sort of this hypothesis about stagnation, and is there something to be said for sort of cleaning the pipes? Now, that study did not delve into, the type of activity that preceded the ejaculation. So we don't exactly know, how they were ejaculating or what type of sexual activity or was involved. But it does appear that, cleaning out the tubes, may be associated with a reduced risk. Now, that being said, these are observational studies, so it could be that there is some other factor that is different about people who ejaculate more than 21 times per month compared to other people. Now, this is a very, well-established study that this came out of, so they collect data on a lot of different factors. So certainly the researchers did their best to, take into consideration as many things as they possibly could in this analysis, but needless to say. So I think, a take-home message could certainly be, that if anything, higher ejaculation frequency may have some sort of beneficial relationship with prostate cancer. However that may be accomplished, it certainly doesn't appear harmful. And, of course, with safe sex practices, since they're on the flip side, there may be some kind of relationship between inflammation or having sexually transmitted infections with increasing the risk of prostate cancer. So I wouldn't do this, while, jeopardizing, safe sexual practices.
Yeah. Yeah. So ultimately, if you ejaculate more than 21 times a month, it may help you. So by all means, go ahead as long as you're safe.
Yes. Yeah. And, we've had a lot of funny conversations about that. I mean, I've had some very fun callers on the radio show over the years, like, oh, Dr. Loeb, last month I was really busy at work and I only had 3 ejaculations. If I have 50 or 70 this month, can I even it out? And, I don't think people need to be so scared about this exact number of 21. That just happened to be the cutoff that they used in this study. I don't think there's any sort of, gospel to this exact number, but, just to keep it in mind. But I think it was overall a positive message. I mean, I definitely had some callers on that segment who were like, hey, I'm going to put my wife on the phone. Can you repeat this again? Because we just have to discuss how if we don't have sex more, I'm going to be at higher risk of cancer. So I think, in general, this is a feel-good study.
Yeah. And sex is not the only way you can masturbate. I mean, you can masturbate, you can do other things. So don't put the pressure on your partner. We talk about that a lot on my channel, so feel free to check those videos out. But in general, yes, masturbation, safe sex practices, all those things seem to be positive, at least in terms of prevention of prostate cancer, but not gospel. In terms of early signs of prostate cancer, so we know screening is there for a reason, but a lot of my audience wants to know, are there early signs or are there things that they should be sort of on the lookout for?
Yeah, and I'm so glad you brought this up because actually this is another big topic of misinformation that we've seen on Instagram and TikTok, where people are saying early warning signs for prostate cancer, if you're peeing a lot or you see blood in your urine or your erections are not good, these could be early warning signs of prostate cancer. No, I'm sorry. Those are not early warning signs of prostate cancer. The unfortunate truth is that prostate cancer just does not have early warning signs. it does not have any of those symptoms until it's at a very late stage. And so that is why screening is important, because you will not have symptoms from prostate cancer. So you would not know that you have it until it was already advanced. So screening is mostly these days just done by a simple blood test. And that is the best way to find it early. If you are already having some kind of urinary problem, like blood in the urine that's related to prostate cancer, then that would likely be an advanced cancer. And it is definitely better to have it diagnosed early, because there are a lot of great treatment options when it is diagnosed early.
Yes. And just to be clear, urinating frequently or having blood in the urine does not always mean that you have a prostate cancer. It can mean that you have a lot of other issues that may be causing those symptoms. So don't freak out. But it is important to get screening. So what are the guidelines now for screening? They have evolved over the last, 10, 15 years. So maybe you can give us a summary of what people should be doing and how often.
Yeah, so no, and that's a great point that you made, that these are usually symptoms of other things. So if you're peeing a lot, that could be that the prostate is enlarged, which isn't cancer at all. That's a totally benign process, and there's treatments for that. So it's very important that if you're having some symptoms in your urine, that you are still seen by the doctor. And blood in the urine, that could be an infection, that could be many other things. And so all of these things should be worked out, but they are likely not due to prostate cancer. Screening for prostate cancer. So this is the way to find it early. And nowadays, what we're really recommending is a baseline test in the 40s for men. And this is really important because it helps tell the risk that you will ever have prostate cancer in your lifetime. And so, that sounds really early, but that is really the best time to do it. Now, the good news is that prostate cancer screening historically was done with two tests. It was done with the blood test and also the prostate exam. And that is not popular. That is a finger in the rectum, and there's a lot of fear and a lot of stigma, and some people just flat out refuse it. And I think, unfortunately, it's been a bit of a barrier to prostate cancer screening over the years, where people just do not want that test, so they just kind of avoid the whole thing. But the good news is that recently that has really moved more into a supplemental role or a second line position. So really, it is mainly nowadays just focused on this blood test. So very easy, could be done with, your annual labs at a physical exam and not even a separate stick. And so I think hopefully this kind of removes sort of this impediment that's been there to prostate cancer screening over the years.
Yeah, and I think, there was actually a recent study that came out that digital rectal exam is not necessary. And I think as urologists, a lot of us are conflicted on this because there's a lot we gain in terms of information from a prostate exam, because you're often seeing us for other things. You're often seeing us for symptoms like going often to the bathroom or other issues that may be indicative of an enlarged prostate or pelvic floor problems, which are all diagnosed with a rectal examination. So again, I think it's not necessary for screening based on the data. But when you see a urologist, you may still be offered that test because we gain other information from it.
Yeah, for sure. I think there are some things that we can find out from it. And for example, if somebody gets the prostate blood test, which is called PSA, prostate specific antigen. So if you get this test and it's a little bit elevated, the prostate exam could actually help to sort out whether it's, likely to be due to cancer or whether the prostate is just really big, because this substance that we're measuring is made by the prostate. So the more prostate there is, the more of it there is, but there could also be a little tiny tumor in there that's pumping this stuff out. And so the question is it high because the prostate's huge, so there's just lots of prostate making this stuff? Or is the prostate really small, but there's like a nodule there, a tumor that's pumping this out? And so you definitely can get some more information by doing the exam, but it's certainly, by no means is it mandatory. And I definitely don't think that anyone should, avoid screening altogether because they don't want this done.
Yeah. And I think there's, the one thing I do caution patients on is there's a small subset of cancers, and I think it's like less than 3% that don't emit a PSA. And so I've only seen a couple in my lifetime. You've probably seen a lot more because they get referred to you preferentially. So maybe you can talk a little bit about that. Are there certain people who should maybe be screened with a rectal examination?
Yeah, I mean, definitely the vast majority of prostate cancers, they make more of this PSA substance. So, it is really a spectrum. I mean, the higher the number is, the higher the risk. But yes, there is a very small subset of some very aggressive prostate cancers, actually, where the cancer is sort of like so aggressive that it's not even like producing this well. And so, yes, could you miss, this very small proportion of cases by not doing the exam? Yes, I think that is possible. However, overall, the performance of the prostate exam is just not as good for cancer detection as the blood test. And if that's going to be the reason why thousands of people just don't get screened at all, then I think if you were to look at this like from a population standpoint, it could be that, the harm of pushing it is more than the gain from these few people. So I think, patients can decide with their doctor, probably people are being offered the test and they can decide, am I willing to risk that I could have one of those small proportion of cancers where the blood test, didn't show it? Or am I okay with just having this exam done and I just want, sort of the full assessment?
Yeah, and I think the other thing you mentioned about having a high PSA is sometimes it can be due to other things like having an enlarged prostate. So what is the utility of getting a second PSA shortly after you have an elevated one? And how often are we seeing that those other issues, for example, an acute infection, which is more readily able to increase PSA sort of dramatically in a short period of time, how often are we seeing that being the cause?
Yeah, so that's a great point. And, as much as we're really lucky that we have this screening test for prostate cancer, and it is a good screening test. I mean, most prostate cancers raise the PSA, and it is how we've been able to find so many cases early. So I think it's really a very helpful test in so many ways, but it is not a perfect test, like so many other tests in medicine. And it's sort of like the check engine light in the car. So when this PSA number, the prostate blood test, is elevated, it's basically like the check engine light that you've got to check under the hood, because it could be cancer, but it could be just the prostate grew, so more of this is getting made. It could be there's an infection or inflammation, and that's allowing more of this to leak out. And so it does not definitely mean it's cancer. In fact, many times when we do biopsies of the prostate to check if there's cancer there because the PSA went up, we find that there isn't cancer. There could be inflammation. It may just be the prostate was big. So yes, it can. So if you are somebody who's found to have an elevated PSA, first of all, don't panic because it may not even be cancer. And second of all, like you mentioned, it's important to repeat the test before doing anything, because if it was something like inflammation, it may just go back down, and then, you can avoid all of the subsequent testing and anxiety. And so definitely what we recommend is that wait 4 weeks and check it again before taking any sort of action or doing anything invasive. The other thing is, I have seen a lot of patients where the PSA was checked when they had a urinary tract infection. Mm-hmm. And we know that if there's an infection or an inflammation there, that it's going to cause this stuff to leak out. And so that is going to raise it, but it's a false positive. This is like a red herring. And so, I don't know why this is happening, but I see people are in the ER for a urinary infection and the PSA is sent, which causes then a whole series of repeat tests, anxiety. I mean, the whole thing is a mess. So if you have a urinary tract infection, do not check the PSA during that time. That is just not useful at all.
Or if you have a catheter. I mean, I'm sure you've seen it too, but there's so many people on the floors in the hospital that had catheters that were getting PSAs checked, and that will falsely elevate your PSA too. So don't freak out. Recheck it when the catheter is out and reassess.
Yeah. So I think it's really just unfortunate because some of these things just cause so much anxiety for people. And the reading is just totally not even helpful.
Did you know that we're now seeing patients not only in Newport Beach, but also in Beverly Hills, Los Angeles? If you want to see me in person and you're located in the LA County area, make an appointment today at www.renamalikmd.com/appointments. Again, that's www.renamalikmd.com/appointments. Looking forward to seeing you. Yeah. And, prostate cancer is really slow growing. So we talk about stopping screening at some point, usually when you have 10 years or less left to live, which is a difficult conversation to have with people. And I have it very often with patients. But basically, because it's so slow growing, at least the teaching is that if you were to get it today and you were to die of something within 10 years, you're probably going to die of something else and not of prostate cancer. So I know the guidelines say 69. Is that typically the age at which most people are stopping screening?
I think it really depends. I mean, some of the guidelines say, no routine screening after age 70. Others sort of use 75, but say, individualized. And I think everything in medicine should really be individualized. I mean, when I ran the New York City Marathon, there were some, people in their 70s who beat me in the marathon. And, and there's some people in their 70s who come to the clinic with their mother. And so, if your mom is still alive and you're in your 70s or you're running marathons, then you probably are somebody who would still benefit from getting a PSA test. On the flip side, there may be some people in the 60s who have some other really major health problems, like maybe, stage 4 colon cancer or something else, where prostate cancer screening may not be really that helpful because the likelihood of prostate cancer causing a problem during their remaining lifetime and undergoing all the testing for it could just cause, more complications and worse quality of life. So I think, just across the boards, whether you're younger or older, that all of these discussions need to take into consideration, your overall health and your goals.
Yeah. And who needs to start screening early? Who needs to start, obviously we get a baseline level in the 40s, but who needs to then routinely get screened?
Yeah, so, the most critical are people who have risk factors. Black men have higher risk of prostate cancer, so the guidelines typically recommend starting screening earlier. If you do have a family history of prostate cancer, that's another group of people where it's important to get screened earlier and to, continue to get screened regularly. And of course, if you know that you have one of these genetic factors, so, somebody who knows that they are a BRCA carrier, maybe their mother and sister both had breast cancer, that is somebody who may benefit from, not only regular screening, but also considering, genetic counseling and genetic testing if they have not yet done so.
Yeah, that's very important. And talk about MRI. So when I was training, there was no MRI of the prostate. It sort of came about probably midway in my training, and now has become very popular in the use of sort of diagnosis and prostate cancer diagnosis. So should everyone be getting an MRI? When do you decide?
Yeah, so MRI is really, I'd say maybe even like the most important advance that I've seen over the course of my career in prostate cancer. And it really is helpful to just, give us kind of a roadmap. And so, it used to be that if your PSA was elevated, the prostate blood test was abnormal, and we confirmed that it really is abnormal, and we don't have some other reason like an infection going on, and then we would just proceed straight to a biopsy. And, biopsy is a big deal. It's invasive. You have to put needles in the prostate. And so there's risks like bleeding and infection. And a lot of them came back negative. In many studies, let's say 25 to 30% of the people in these studies would have cancer. And that means all the rest of these people had a biopsy and no cancer was even found. But the way that biopsies have been done historically may surprise a lot of people. So actually, it's just been a random sampling of the prostate. And so basically, if the prostate looks like this, we would just take sort of 6 needles on this side and 6 needles on that side. So I kind of describe it like if you had like an apple, right? And there's like a little rotten section in the middle of the apple. So if I just stick 12 needles into the apple, 6 on one side, 6 on the other, I mean, if the entire apple is rotten, then the needles are going to hit the rotten spot. But if it's only a very small area that's rotten, the needle may or may not actually hit that area. So there was a lot of what we call sampling error, where the needles are actually only really checking like 1/1000th of the prostate tissue that's there. So people would get these biopsies and they may be told they have no cancer, but it may be that the biopsy just missed the cancer because it was small and it just didn't happen to be like right where those needles went in. And so the way that MRI has revolutionized things is that, first of all, it's just a lot better imaging than we had before, where we can actually see now if there's a suspicious area in the prostate. So that really helps to know like who definitely needs a biopsy. And if the MRI doesn't show anything concerning at all, then people may decide they'll just sort of wait and see over time. So some people whose MRI come back negative don't even get the biopsy now, because there's really only about a 9% chance that it's going to miss an important cancer. So it's very good. I mean, it's not perfect, but it's about 91% in terms of finding an important cancer. So I think that's really very good. But the other thing that it does is that when it shows an area that's concerning, not only does it tell us this person needs to have a biopsy, but now we can actually target the biopsy to that area. Basically just like any other cancer in the body. I mean, can you even imagine like a breast biopsy and just somebody gets needles sampled around the entire breast? I mean, no, like that's not how, other solid tumors are typically done. Like a breast biopsy is targeting a suspicious lesion that was found on imaging. And so the fact that prostate, up until recently, the biopsy process was just sort of this like random sampling is, pretty unique in terms of diagnostic testing for cancer. So now I feel like we're finally in the new millennium here where biopsies can be targeting an area that's suspicious. And so I'm sure that nobody will be surprised to hear that this increases the yield of the biopsy. So we could select people better, whether they actually need the biopsy. And then if they do, we can do a much better biopsy by honing in on the area that was suspicious instead of just putting needles all over randomly.
Yeah, I think that's been very transformative. I mean, saving people biopsies is huge. And you're right. It seems silly that we could never target lesions before, but we didn't have that sort of imaging modality. Ultrasound was not sufficient to see these abnormal areas. So it's been really wonderful and transformative, I think, for the management of prostate cancer. In terms of people who are diagnosed with prostate cancer, now we can get into a lot of details about this, but we'll sort of make it more general in terms of what are, I think, the biggest misconceptions or take-homes that people often have once they're diagnosed, and let's start with that. So, with people who are diagnosed with prostate cancer, it's really important to figure out, how high risk is the cancer, because if it's low risk, if it's not an aggressive cancer, you may not need any treatment at all. And so maybe the biggest myth is just that cancers need to be treated, because not all cancers actually need upfront treatment. And prostate cancer is one of these, because thankfully, many are actually very slow growing and can just be watched over time. And the reason that this is so nice is because treatments can have side effects. The prostate is in a real sort of high price real estate.
It's around a lot of really important stuff. There's the nerves that control erections. It's near the rectum where the poop comes out. It's near the bladder. So if anything you do to the prostate or sort of manipulating that area can affect things like sex and urination and bowels. And so if it's not necessary to, do anything up front, it's really nice to just preserve quality of life as long as possible. So this is something we call active surveillance. And it is active. So the idea isn't like, see you later, don't worry. That is monitoring the cancer over time in an active way to see like, okay, if things start getting worse, then we need to, kick into action and do some kind of treatment. But many men can buy years or even avoid treatment altogether during their remaining lifetime if the cancer sort of stays at bay. So that's the good side for the very low risk kinds of cases. Now, if somebody's diagnosed with a higher risk prostate cancer, then treatment is really important. But if the cancer hasn't spread, there's a lot of different ways to treat cancer in the prostate, things like surgery, different kinds of radiation, and, some more sort of newer types of treatments where you can even, if it's just cancer in one location, it may be possible to just do sort of a spot treatment, more like the sort of idea of a lumpectomy sort of thing, but just, either freezing it or what we call ablating the tumor. Just put a probe in and kill off that area while trying to reduce the side effects. So there's definitely a lot of investigation now into some of these like minimally invasive kind of options as sort of a middle ground for people whose cancer is not low risk, but not super high risk, who may want to see if this could reduce side effects. So lots of great studies happening to see if there's kind of new ways to treat it in the future, and whether doing this kind of treatment, can still have good cure rates in the long term.
Yeah, this is really exciting, I think. And granted, there's not a lot of, it has to be a focal cancer, and prostate cancer is not always focal. So I think it's really important to know that if you have a cancer, you need to understand that if it's not focal, those treatments are not accessible to you, unfortunately. So I think that's really important to understand and realize that some of these, are these still considered investigational, some of them?
Yeah. Some of these are still investigational. And this is definitely something that we do see advertised quite a bit on social media. Some of these treatments like HIFU, HIFU, which stands for high intensity focused ultrasound. So this is just one of these sort of less invasive treatment types that's being studied. And the fact is we just don't have the long-term data that we have for some of these other things like surgery and radiation. So, if you're in your 50s, like I can't tell you that, for the next 40 years of your life, let's say, that this thing is going to, cure you permanently. That being said, if you have a cancer that is suitable to this, it's definitely something that can be done that may have less side effects, and other treatments could be done afterwards if it isn't enough. But you're right, it really has to be exactly the right cancer for one of these treatments to even be possible. Yeah. And so prostate cancer is just such a spectrum, and no two cases are exactly alike. Depends on how much there is, exactly where it is. Can you see it very well on the MRI? What is the person's priorities? Some people, maintaining their sex life is the number one priority. Other people may not be sexually active, and, having the highest rate of cancer control is the number one priority. So I think working with the patient to figure out what is going to work for them and their tumor is what matters.
I think it's so great now that people who treat cancers, and in general, we're looking at more of the quality of life of the patient, not just from the cancer, but even after the treatment. And I think that's so important for something like prostate cancer, which can dramatically affect your quality of life. Now, treating cancer is super important. And if it's aggressive or high risk, then I would say be as aggressive as possible. But in these lower risk patients or intermediate risk patients, I think there's room to discuss this and sort of work on how can we maximize your quality of life. What I want to know is, there are, as you mentioned, there's people who may be selling these therapies at a high price point and they're still investigational and they may be really good salespeople. How can people know whether, like, what are some red flags, I guess, in terms of people who are obviously in a vulnerable state with prostate cancer, looking for the best treatment option possible from getting sort of sucked into things that maybe are investigational and should be only reserved for a clinical trial?
Yeah, I mean, it's so important. And, I've seen some really scary stuff on social media, even videos for injecting herbs into the prostate or things like that that are just like not even evidence-based. They're not in the guidelines, but yet, these have a lot of views. So, I mean, if something is being told to you that this is, effective treatment with no side effects, that is, I'm sorry, there is no treatment that has zero risk of side effects. Even the less invasive treatments still have a risk of side effects. So I think, number one, if you're being told that this treatment has no risk of side effects, that is just not realistic, unfortunately, in 2024 for prostate cancer. Maybe one day we'll get there, but we are not there yet. And, I think some of the best ways to sort through this stuff is, first of all, to figure out who is the source of the information and not to just get your information from one source, cross-referencing different, trusted sources of information. And also, I think just seeing different types of doctors is really important for something like prostate cancer. And most cases are not an emergency. You do not have to get treated in the next week or 2 weeks even. So, there is time to take your time, talk to different doctors, get different opinions. And it's so important. For example, you could see a urologist and a radiation oncologist and even a medical oncologist and just hear what everybody has to say about your case. So there's no rush into this. I think actually it's well worth taking the extra time to make sure that the treatment that you're going to get is the best one for you, because we see a lot of treatment regret. That is like people who think back like, ooh, if I knew what this could have been like, I never would have done this. And that's really sad, to have that situation. And so making sure that you are as well informed as possible before you do anything is really key.
Yes, that is really good advice. And I think taking your time for something like prostate cancer, and this is not true for every cancer, but for prostate cancer, taking your time and getting the advice of multiple disciplines and different types of doctors is going to be really beneficial overall, and just making sure that you cross-reference. Like you said, like there's very good resources like the CDC, and the Mayo Clinic has good content, and now on YouTube they have health verified sources. So just sort of looking for sources that are trustworthy and reliable, and sort of not falling into the trap of looking for something that's like sounds amazing, like no side effects, 100% effective is really important.
Yeah. And, so in addition to some of those for prostate, there's the Prostate Cancer Foundation has, great educational content. In fact, they have a patient guide that you can get through their website, as well as stuff on YouTube and other social platforms. Zero Prostate Cancer is another great organization. They have a lot of content as well as support groups that can be very helpful. And, support is something that is really important going through this prostate cancer journey. And they have all kinds of support groups for different types of people, as well as partners of patients, because this condition can have a lot of impact for the partner as well. And so it's nice that those kinds of resources exist. The Urology Care Foundation is another group who has a lot of good content that's trustworthy about prostate cancer. So there are a lot of good things that are out there. So that's not to say, everything on the internet is bad. I think the internet is actually really wonderful for a lot of things about prostate cancer, but you do have to be careful.
Are you loving the Rena Malik MD podcast? Well, I love each and every one of you, and I'm truly honored that you choose to spend a bit of your day or a bit of your week with me. Did you ever hear the actual story of why I started making content online? Well, when I was a resident, I remember having a patient who had bladder cancer. And in order to treat her bladder cancer, we had to remove it and then reconstruct a new bladder called an Indiana pouch. Now, with this new bladder, she would have to catheterize herself through a stoma or an opening on her abdomen in order to empty her bladder. So after surgery, immediately she did great. She went home and no major issues. But subsequently, over the next couple months, she started getting readmitted over and over again to the intensive care unit. And we were really wondering what was going on. Eventually, we figured out that she didn't truly understand that she now had to catheterize herself to empty her bladder. Just the simplest thing that was so pivotal, she didn't understand that. And it was then that I realized as a urologist, I could do the perfect surgery. But if my patient didn't understand the consequences of that surgery, then I failed as their doctor. And once I started practice, I realized that I couldn't teach people everything they needed to know in the 15 or 30 minutes I saw them in my office. And that's when I started creating all my Rena Malik MD content to offer free education to people around the world. And I can tell you that it has been truly one of the most rewarding experiences in my life. And in order to keep providing free content, we need your help. If you are getting value out of this podcast or my other content, I encourage you to join our premium membership. As a member, you'll get early access to the audio and video of the podcast completely ad-free, transcripts of all the episodes, and exclusive access to Ask Me Anything episodes that occur once a month. And during those episodes, I answer questions that are asked only by premium members. So join us today at renamalik.supercast.com. Can't wait to see you there.
In terms of people who are newly diagnosed with prostate cancer, are there certain lifestyle modifications that you recommend?
Well, really the same things in terms of preventing cancer, so eating more plant-based is very important for people who are diagnosed with prostate cancer. We have a new paper coming out showing that the more plant-based you eat after you're treated for prostate cancer, the better scores you had for erections, urinary control, and bowel function. And so really important still, these dietary factors. So you want to, avoid the meat and dairy and have as much as possible of plant-based food. Physical activity, also really important. The physical activity guidelines for Americans are that people should be getting at least 150 minutes per week of moderate intensity physical activity. So that's like, let's say 30 minutes a day, 5 days a week, comes out to 150 minutes a week. Moderate intensity is where you can talk, but you can't really sing. So that's just sort of like a gauge of what the intensity should be like. Now, if you do like more vigorous activity, then you only need 75 minutes a week. So if it's vigorous, this means you can't really easily have a conversation or sing while you're doing this kind of activity. So that would also be, a great option. And then in addition to the aerobic physical activity or the cardio, you also want to be doing resistance training at least twice a week. And so this is really what all Americans should be doing, but very, very important in cancer because there's a lot of very well-established benefits from the physical activity in prostate cancer, where it's been shown to increase people's energy and better quality of life during their prostate cancer journey. Another thing to consider is good sleep. Unfortunately, sleep takes a big hit after a prostate cancer diagnosis. We did a big survey about a year ago of patients with prostate cancer, and more than half had poor quality sleep. And actually, about more than 3/4 of their partners have poor quality sleep. And I think there's a lot going on here. Prostate cancer treatments could affect, sort of urinary patterns. Some patients with prostate cancer take drugs that cause hot flashes. But then, just other things like the anxiety of having a cancer and things like that. So a lot of things can affect sleep, but healthy sleep is also very important for, good quality of life. And so just something not to forget about sleep in there.
Are there things that potentially reduce the risk of biochemical recurrence or prostate cancer coming back after you've been treated? Are there things lifestyle-wise that can support that?
Yeah, so we have a new paper coming out also with the plant-based diet and showing that consuming more plant-based food reduces the risk of progression of prostate cancer. And this is after people are diagnosed, so it's never too late to improve the diet. There's also been studies from this same study population showing that brisk walking may reduce the risk of progression of prostate cancer, or high intensity interval training. So, physical activity, very important. So all these same things have, are potentially beneficial in terms of reducing the risk of progression of the cancer.
That's really great. That's really encouraging. And, guys, if being plant-based means you have better erections after prostate cancer, I think that's a pretty good endorsement of dietary change.
Yeah. Well, it's also associated with better erections in people who don't have prostate cancer. So that was actually the impetus for the study, because we published that about 2 years ago, that people who ate more plant-based were less likely to get erectile problems, to begin with. However, the prostate cancer population is a bit challenging because, people have surgery or radiation for prostate cancer have some added challenges in terms of erection, since those treatments may affect the nerves that are controlling the erection. So above and beyond sort of the problems that contribute to erection issues in the general population, things like, obesity, diabetes, smoking, prostate cancer treatment kind of gives this extra insult. So it's nice to see that even in this population where there's some really additional barriers to good erections, still the dietary pattern was significantly associated with better scores for erections. So I think it's nice, patients ask me all the time, is there anything I can do? And there is something that you can do. And so I like this because I think it's nice to actually have a positive message, because, you don't want to feel hopeless. We have a lot of hope. There is a lot that you can do to reduce the risk of progression and to have a better quality of life. And so we should do it.
Yeah. Yeah, I know. And you make a good point. So, typically you would think that a plant-based diet would only affect the blood flow aspects of erections, and prostate cancer treatments often affect the nerves to erections. But that is great, because a lot of things that we do for people who have blood flow issues don't always work for men who have prostate cancer in terms of treatment. So that is really interesting and great information.
Yeah, thank you. Yeah, no, I think this stuff is all tied together, right? The penis, these blood vessels are very small. The blood vessels in the penis are a smaller diameter than the blood vessels in, the heart, or that go to your brain and stuff like that. So that it is a very early indicator. If there's not enough blood flow, it can be the indicator that that there's something wrong in terms of the blood flow in the body. And, there's been randomized trials. For example, Dean Ornish has published randomized trials of a vegan diet and physical activity to actually, reverse coronary plaque in people with coronary heart disease. And that was in, JAMA, one of the leading medical journals many years ago. So if it's possible to actually reduce, the plaque in coronary vessels, and also even to cause remission of diabetes, these kinds of factors are very important in the penis with these very small blood vessels in terms of trying to make sure that you can get as much blood in there as possible.
Yeah, absolutely. This is a big question I think a lot of people have. So if they've gone through prostate cancer treatment and now their PSA is undetectable, or at the lowest point is going to be, for example, after radiation, what about starting testosterone replacement therapy? From a cancer standpoint, what are your thoughts?
Yeah, so great question. So this is a huge issue of controversy over the years, because actually even the Nobel Prize many years ago was awarded for this discovery that if you basically do either surgical or chemical castration and reduce somebody's sex hormones to a castrate level, that is a way to treat advanced prostate cancer. So the thought was, if the treatment for advanced prostate cancer is to achieve castrate levels of sex hormones, then is the opposite a problem? So if somebody actually takes testosterone, could they be, increasing their risk of prostate cancer, or could it cause the progression of prostate cancer? And so that's been a real big controversy. Now, the current data, thankfully, suggests that people who have low testosterone, that taking testosterone therapy does not increase the risk of prostate cancer. So we published a big study on this out of Sweden. We looked at the entire country of Sweden, at everyone who used testosterone prescriptions there, and we linked it with the cancer registry to see who got prostate cancer. And actually, the long-term users of testosterone actually had a lower risk of high-grade prostate cancer in the long term. And so we did not find anything that was concerning there. And then even more recently, there was just this big randomized trial of testosterone therapy versus placebo. And again, they did not find an increased risk of prostate cancer with testosterone therapy. So I think we could say it's been put to rest that testosterone therapy in people who need it because they have low testosterone that's symptomatic doesn't cause prostate cancer. Now, for somebody who already has prostate cancer, there isn't as much data on what to do, because what happens if you have prostate cancer, but you do have low testosterone and you're symptomatic? Maybe you have low energy, low libido, erection problems, whatever it may be. And can it ever be safe to take testosterone in these people? There's different guidelines on this. Some of the guidelines say basically there isn't a lot of long-term data on this, so we don't really know the balance of benefits and harms, and talk to your doctor. There are other guidelines that suggest that if the cancer has been treated and there's been an interval of time where there's no evidence that the cancer is recurring, that it is something that can be considered, but it requires, a thorough discussion of the risks and benefits with the doctor, because we just truly don't have the long-term data, and careful monitoring. So I guess that was a very long answer to say that, yes, testosterone therapy can be considered in people who have been treated for prostate cancer and have gone a period of time where they have no evidence of disease. But just like anybody else, testosterone therapy should only be used in people who actually have a documented low testosterone who are symptomatic. And so there is some inappropriate use of testosterone in this country. And so it should not be used in people who haven't had their testosterone level checked. Mm-hmm. And so that's one thing. And especially if they have a history of prostate cancer, because we need to be really sure that that person really needs this. If we were to even consider this, given the fact that there are potential risks and benefits here.
Yeah, I think it's really important to have that discussion, but it's also really helpful for quality of life for people who are symptomatic, because there are significant benefits in libido, in mood, in erections potentially, in desire, in even, like I said, depression, people who are having depression, and some bone health benefits. So I think ultimately there's quite a bit of benefits for testosterone when done safely and appropriately and monitored. It can be done, and it can be done safely. But knowing that starting testosterone typically, if you do have prostate cancer and your PSA is very low, will increase your PSA slightly. And so not to be alarmed, but just to keep an eye on it, because your testosterone receptors at some point when they finally get that testosterone, they will increase your PSA.
Yeah. And so, I think the main thing here is just to make sure that you have a doctor who really is an expert in this area, because this is a tricky topic. And so testosterone is really not something that should be given by just everybody, because it needs to be really monitored, and especially in somebody with a history of prostate cancer. So I would not do, just any old place. I think finding somebody who specializes in testosterone therapy is really very important for this.
Yeah. Absolutely. Well, we end our podcast with a few sort of questions that are kind of about you more than just your expertise. But is there something, before I get into that you want the general public to take home that we haven't talked about prostate cancer?
I mean, I think the main messages are really, to talk to your doctor about screening if you're a male over the age of 40, because that is the best way to find it early, and that you do not have to have the finger test for the prostate exam if that is a barrier, and just general healthy messages, meat is not good for cancer, so eating more plant-based, getting physical activity, these are all, just really good strategies to reduce the risk of prostate cancer and for better quality of life in general.
Great. So tell me something that you know now in your life that you wish you learned earlier.
I think I wish I learned earlier that meat was carcinogenic. I mean, I don't think I would have consumed any hot dogs in my lifetime if I knew that was putting me at an increased risk of cancer. So I wish that there was more awareness about that.
Yeah, that's a good one. What is a non-negotiable, something you have to do every day?
Exercise.
Yeah, you are really good at that. I know you've always been exercising every day.
And, I'm a busy person. Everybody's busy, but I think you just have to prioritize self-care. And exercise is just so important for mental and physical health. And I think there is always a way to make it happen. And, even just reducing the amount of sitting, park further away in the parking lot, take the stairs. I mean, whatever it has to be or whatever it looks like, even 10 minutes is better than nothing. So it's interesting because, it used to be that the physical activity guidelines for Americans had like a minimum amount that you had to do per day, and they removed it because it turns out that literally like any activity is better than no activity. So that is non-negotiable.
Yeah, and I have to say that I have been actually thinking about this a lot, the step counters that became very popular. I think they've been so helpful because just like you said, just walking a little bit more, whether it's parking further away or just taking a 5-minute break in your day and walking, like if you do that throughout the day, that adds up. And so just adding that into your day can be very simple, very manageable, and very doable.
For sure. I mean, I think and also, it can be sort of a gamifying situation, so if like using the step counter gives you a challenge or a goal, I love that. I mean, some people really thrive off of that kind of feedback. So whatever it is that you need to do to like get inspired. And there's so many ways to get physical activity, people don't have to go to the gym if you just don't like that, so just figure out whether it's, gardening or whatever it may be. But there's a lot of ways to get physical activity that are not involving like repetitive exercise if that is just not something that you enjoy.
Yeah, pickleball's all the rage right now. Try it, right?
Exactly.
What is something, I know you're passionate about many things, but what's one thing that you wish you could do or would be done that would change the world?
Well, I mean, I think everyone having access to the internet would really change the world because I think it is just so fundamental to have, democratization of information and the availability of knowledge globally.
Yeah, that's a good one. I think we take that for granted in the United States because public libraries have the internet. So even if you don't have access, most people can access the internet in the U.S. But definitely, and there's certain areas in the U.S. where they don't, but also around the world. It's a big thing that not everyone has it. Last question. What is a health hack or something that you think improves your health outside of exercise, which you've already mentioned, that you would give to people?
I mean, I think just, having an overall sense of well-being and stress reduction. I mean, everything is really tied together, the mind and the body, and I think, just focusing more on finding ways to have pleasure in your day and reduce stress, whatever that may be. I don't know if you've seen the Blue Zones documentary, but this idea of finding purpose and meaning, and people who do that really do live longer, and there's studies on this and social connection. So maybe some of the secret to health, goes beyond some of these traditional things that we think about, like screening and seeing the doctor and even, nutrition and physical activity, but just about how we live our life and our mindset and how important that can really be for our longevity.
Yes, I love that. I think purpose is so important. I think that's why sometimes when people retire, they don't have a purpose, and that can be a big decline in their health ultimately. And also social connection. I see so many people with issues like incontinence where they become isolated and they don't leave the house and they don't spend time with people because they're embarrassed. And I tell them, I spend time and I tell them, this is, you can't live like this. Like you will, this is so important for health, having social connection. It doesn't have to be best friends. It can be social connection with your neighbors or with your barista or with your grocery person, but just having those connections with people is so meaningful and so valuable for our overall health.
Yeah, absolutely. I mean, and there's just so many ways to get that, whether it's through, church or group fitness. I mean, whatever it is that drives you, but I think everyone trying to find what makes you want to wake up in the morning and get out of bed, what is going to give your life more meaning, and who can you surround yourself with to provide support that has, some common meaning with you.
Yeah, absolutely. Well, thank you so much.
Thank you.
Thank you guys so much for joining us today on today's episode of the Rena Malik MD podcast. If you enjoyed this episode, please be sure to check us out on Apple or Spotify podcasts and leave us a rating or review. If you're listening on audio, make sure to check us out on YouTube and subscribe to our channel. These are easy, zero-cost ways to support the podcast so we can continue to grow and create more content. And if you're enjoying this, feel free to follow me on other platforms, including Instagram, Threads, Facebook, TikTok, X, and anywhere else really. And as always, remember to take care of yourself because you're worth it.